Cardiac disease is looked upon very seriously in sport. Exercise is very stressful to the heart. The heart has to work very, very hard during exercise. So an individual harboring cardiac disease is much more likely to succumb or die suddenly whilst playing sport, whilst the heart is doing too much. So in general, people with cardiac diseases, these are the sort of inherited or congenital cardiac diseases that I've talked about, are not usually permitted to continue to exercise or participate in disciplines that involve moderate to severe exertion. There are some situations in which these conditions can be cured, such as anomalous coronary arteries and Wolff-Parkinson-White. If these conditions can be cured, the athlete can go back to sport. But at this time, athletes with known disease are usually disqualified from competitive sport. There are lots of individuals that don't have any symptoms. In fact, most high-profile athletes that have died in the last 15 years have not reported cardiac symptoms. And that's where the concept of screening comes in. Because most athletes don't have symptoms, certain sporting governing bodies, including the International Olympic Committee, the European Society of Sport Cardiology, and the FIFA, all recommend screening athletes, all athletes, on the understanding that many athletes who have serious conditions won't have symptoms. So they want people to have a history and examination, bearing in mind that these may draw blanks, but they want an additional ECG. So the guidance coming from the IOC, FIFA and ESC is for every athlete to undergo a health questionnaire, examination and a 12-lead ECG. People who've got normal findings on history, examination and ECG are allowed to compete. Those people who've got abnormal findings undergo further investigation. If they're cleared, they're allowed to compete. If they have disease, they are managed according to established protocols that have already been devised by the European Society of Sport Cardiology and the Bethesda American guidelines. Naturally, people with potentially fatal conditions are not allowed to compete in sport anymore.